Hi, this is Dr. Thompson in Boone, Iowa, chiropractor. I was recently talking to an individual about chiropractic, and the comment that the person made was that, well, once you start going to chiropractor, you've got to go for the rest of your life. And so I got to thinking about that, and there's I think a misconception out there as far as that statement, and I wanted to take a moment to try and explain that to you. Uh, there's two different ways of looking at that type of a care approach. There is preventative care, and then there's also what's called maintenance care. And let me explain to you the difference between that. Preventative care is a situation where a person doesn't have a problem and they're trying to prevent that problem from occurring. So, for an example, let's say low back pain. The person doesn't have low back pain. They come in and it's like, doc, I'm doing pretty good, but I want to try and avoid having low back pain in the future. What can I do? All right. And so we'll look at the situation. Maybe there's some things at work or, as far as ergonomics, or there's certain types of exercises or training that they can do. And there's some good research to back that up as far as trying to prevent the problem from occurring. And so that person may come in on a basis, say, for example, once a month or once every 3 months or once a year, whatever that situation may warrant. And so with that, they can continue that type of care. So that's one way of a long-term approach. The other one is maintenance care, which is a little bit different. Maintenance care is when a person actually has a problem. They'll come into me and, let's say, getting low back pain. We'll go through, fix whatever the ailment may be, and then they want to try and maintain that level of health. So they may come in on a periodic basis in order to try and maintain that level of functioning. Now there's a couple of different ways that can break down. One is that we can completely resolve the problem, and then they want to continue to address any issues that may be underlying or may create that problem from coming back. The other situation is with maintenance care is sometimes we can't actually fix the problem. A good example is someone that comes in and they've had surgery, low back surgery, or they've had a major trauma, a major fall, car accident, something where the tissues have been so damaged that they're never going to work properly again. So we may not be able to get them completely out of pain, or may not be able to return all their complete function. But what they want to do is they want to keep that problem from getting worse. And so that's when we enter into a maintenance program in order to try and maintain that level of function or pain level. So that's another reason that some people may come in on a more regular basis or for a long-term basis. Again, it's going to vary a little bit on how often do they need to come in. I have some patients that come in about once every 2 weeks, and I have others that come in about once every 3 or 4 months. And it's really based upon an individual. You have to look at their situation and, okay, what do we need to do in order to maintain this particular level of function. So anyway, I hope that explains to you a little bit of the difference. So it's kind of a falsehood as far as, once you go to a chiropractor, you got to go for the rest of your life. Just need to understand that.